It's so exciting to see everyone coming together to work on this critical issue. The rise in childhood obesity is not news to many of us. We've tried. We've worked within our organizations and our companies and our cities to do what we can. We have to work collectively if we're going to turn this problem around. Meeting the obstacles as one unit, as stakeholders for South King County, is critical. I know that in doing so, we can accomplish great things.
We now know that 30% of all children in the United States are overweight. This is a staggering number. We also know that children who are overweight go on to develop heart disease as adults. We are seeing autopsy studies showing that children as young as 2 years old beginning to develop the early stages of heart disease. Children ages 6 to 19 are shown to be as old as 45 years old when it comes to their heart health.
Childhood obesity is an epidemic affecting nearly 30% of the kids in South King County. We've all heard the possible reasons why and the contributing factors: ethnic and racial disparities, poverty. We've all heard the consequences obese children face. And we all know that more than half of obese children become obese adults. And that's what brings us all here today, to effect change and reduce the number of obese children in South King County.
We're pleased to be hosting a first event to begin to address the problems that we have as a nation and as a region of childhood obesity. South King County has a high percentage of children that fall into that category. We want to get kids away from their electronic devices and get them out playing in our parks and utilizing some of the things that are available to them. And at the same time start talking about better nutrition, better food items that are available for families to consider, and to start addressing this issue in a very proactive manner.
In the city of SeaTac, we're very concerned about the childhood obesity epidemic. In South King County, we are constantly trying to improve our community through bike and ped planning. Recently, through the communities putting prevention to work, as a collaboration through the Highline School District, the cities of SeaTac, Des Moines, Burien, Normandy Park, and some of the unincorporated came together to form a Safe and Complete Streets plan. With the ICANN resource, our community is going to be able to find places close to home and work where they can be more active on a daily basis.
Childhood obesity has become a problem not only across the United States, but of course even in Des Moines. And for that, we are committed to trying to address those issues through exercise and through proper eating.
Childhood obesity is becoming a serious problem, and as a King County city, Tukwila wants to be a partner to address this issue.
We have so many of our children living in poverty, and poverty is a major cause of obesity. We need to work together, to cooperate together, to find more ways to get our children outside. We are working with our school districts, our park departments, and many other departments in our cities to try to help our children and to help the parents see the value at the same time.
We have a large immigrant community, and a lot of families come from areas where they're able to grow their own food, and there are much more opportunities to walk and take other forms of transportation. And when you come to more of an urban environment like we have here in South King County, they lose those opportunities to have those healthier options, both for recreation and for food and nutrition.
We are concerned about the growing rate of childhood obesity in our community and look forward to working with others in South King County towards a solution.
The kids we worry about the most are often the ones that suffer from childhood obesity. If we're going to have young men and women have the opportunity to take advantage of the wonderful education programs we have in our Federal Way School District, as well as all the other schools in South King County, it's equally important for us to let them know the importance of healthy nutrition, because the danger of allowing these young men and women to suffer the challenges of obesity is the fact it distracts them and takes both them as well as our schools away from the basic mission of ensuring that they get the education they deserve. I'm very, very supportive of this program of ICANN, because it's another opportunity for all the cities in South King County to get the message out.
Health needs to start with each of us individually, a commitment, a way of thinking. I am very excited to know that there is a regional approach to actually collaborating together to bring this sense of health to the community through all the different cultures, through different avenues of thinking about one's health.
Hi, I'm Governor Jay Inslee, and I'm sorry I can't be with you at this delightful kickoff of the efforts for ICANN. But I do want you to know that childhood obesity is an issue I really care strongly about, and therefore I really applaud your initiative to do something about it in South King County, about what might be considered an epidemic. Now, last month, the Centers for Disease Control and Prevention announced that Washington was one of 18 states that had seen a decline in obesity rates amongst low-income preschool kids between 2008 and 2011. The remarkable thing about this is that in 2012, about 25% of our low-income preschoolers were overweight or obese. Additionally, in 2012, about 23% of 10th graders in our public schools were overweight or obese, and the rates for 10th grader obesity have unfortunately remained about the same for the past decade. So we're moving in the right direction in some ways, but these statistics show that childhood obesity is still a very serious problem in our state. Back in 2009, when I was in Congress, I joined Senator Tom Harkin from Iowa and other leaders to introduce the Fit Kids Act. Also, we used to call it the Leave No Child on Their Behind Act. But the FIT bill actually stands for Fitness Integrated with Teaching Kids. And the goal is to combat childhood obesity by strengthening elementary and middle school physical education programs. This important bill has been reintroduced in 2011, and 2013 is currently held in committee. So it's more important than ever that communities find grassroots ways, such as ICANN, to address this problem. And through your work, leveraging resources around activity and nutrition, by identifying and filling gaps in resources, and by making it easier for people to find the resources they need, ICANN is on track to truly make a difference in our state's obesity rates. As we know, research shows that healthy children learn more effectively and achieve more academically, and they're more likely to be healthier as adults. So ICANN is a model program that we'll be watching closely in our governor's office. I applaud your efforts, and I look forward to hearing more as the program progresses.
I'm proud to join you in declaring that I can and will support efforts to reduce childhood obesity.
I can make a difference, and so can you.
I can and will support you in your efforts to reduce childhood obesity and give our kids a chance at a long and healthy life.
I can and I will support all of these efforts to address childhood obesity.
I can and will support you to end the childhood obesity epidemic in our community.
I can and will support any efforts to reduce childhood obesity.
I can and will support the ICANN initiative.
I can and will support you to end the childhood obesity epidemic in South King County.
I can support efforts to reduce childhood obesity in South King County.
I can and will support efforts to reduce childhood obesity in South King County.
I can and will support efforts to reduce childhood obesity in South King County.
I can and will support you to end childhood obesity in South King County.
Rest assured that I can and I will support your combating childhood obesity. Good luck. I look forward to working with you.